First this afternoon, an area medical center is sharing its approach to squandering COVID-19 in our region. Joining the show this afternoon from OSF Healthcare is the Chief Operating Officer, Dr. Mike Cruz. Doctor, thank you so much for being here this afternoon.
Thanks for having me.
Wonderful. First things first, let's talk about how is OSF Healthcare staff handling the increase of COVID-19 cases?
Yeah, really excellently. Given this resurgence actually looks really different and feels different than it did 6-7 months ago. The demands are different, the season's different, and we've learned a lot together. Learned a lot about this disease and illness clinically, not just as a nation, but we learned how to take care of it at the operating unit level in the ICUs and on the floors. So there's really an excellent esprit de corps despite this intense resurgence of how it's impacting the healthcare system. So I think the sense of teamness, the sharing of resources, being supportive of each other, and being a Christian Catholic ministry, the spiritual healing and support is a critical piece to how we do our work at OSF. I couldn't be more proud of the work of this team and the healthcare mission partners are doing today.
That's amazing. At the beginning of this year in March, there was a really huge demand for PPE and it was far and few in between. So what's the demand like now for PPE for your staff?
Yeah, so that's a great point. So once again, that shift is tremendously different than it was 6 months ago. If you recall, this was about the masks, the gloves, the access to the gowns, the caps, the covers, and some of the equipment, the ventilators, and it's completely different now, mostly because we've learned and we've pivoted off that, as many healthcare systems have, to how we distribute those resources more evenly to tolerate the ebb and flow, the speed to decision making of how we make those decisions. So once again, we learned about agility and speed to decision, leveraging a large healthcare system over 52 counties. That looks and feels very different as a result of what we learned in the spring. And I think there's a lot of innovative approaches that we've done through St. Gabriel Digital Health and how we do the virtual visits, our chat bot with Claire, and a lot of the contact center and on-call, and all those resources that we brought to bear to really offload the amount of pressure that would be felt traditionally at a healthcare system level or at the operating unit or hospital level. So we learned tremendously about the virtual health and how we can deliver those telephonically or virtually within the medical group practices for specialists as well as primary care. And all those add up to decreasing that demand and the pressure put on at the hospital level for that PPE as well.
And this kind of segues into my next question. What's your biggest tip for Central Illinoisans to remain safe throughout now and then throughout the holiday season?
Well, I'm just going to reinstate what seems to be pretty obvious, the 3 W's, and I'll start with masks, but hands and watching our distance. I think it's critical. It works, it's known, and we just have to be really conscious about those decisions we choose to make at our home and our get-togethers, and as we do our work, more distributed and perhaps doing more work at home. So a business and a healthcare system can really redistribute the amount of pressure that's put on by gathering people for business and meetings and committees that need to take place.
And Doctor, I have just a few seconds left, and I wanted to ask you what your thoughts are on the Pfizer vaccine and being available here in Central Illinois at some point.
Yeah, well, once again, the learning, whether it was steroids, hydroxychloroquine, remdesivir, now BAM, for antibody, and now the vaccine. So these are all the things that we've learned, and we're going to have that available. And once again, how do we distribute that? How do the feds distribute to the local health departments, and then how do we distribute that across the healthcare system? So we have infrastructure to support that here in Peoria through our central distribution center, and we work closely with the pharmacists, the nurses, and the clinics and offices to administer that vaccine as effectively and quickly as we possibly can. And really the rate limiting step is the production, but we anticipate that it won't be just one vaccine, so it's going to make it logistically and operationally somewhat challenging, that we could conceivably have 4, 5, or 6 different vaccines that have gone through that FDA approval EUA process.
Doctor, thank you so much for your insight. We thank you kindly for joining the show this afternoon. For more information, more on this interview, head on over to ciproud.com.